Number 2, a 12-year-old girl with a 1-year history of systemic lupus erythematosus is brought to the physician for a routine follow-up examination. During the past year, she has done well, with the exception of occasional mild frontal headaches, fatigue, and arthralgias. The results of regular laboratory evaluations have been stable. She has missed 20 days of school in the past 4 months. Her parents expressed concern that sending her to school might cause her to be exposed to children with contagious diseases that might exacerbate their daughter's condition. The child tells the physician that she misses seeing her many friends at school. Passive motion of the elbows, wrists, and knees produces mild discomfort. Physical examination shows no other abnormalities. Which of the following is the most likely cause of the patient's excessive school absences? 1. Lupus arthritis. B. Lupus cerebritis. C. Malingering. D. School phobia. E. Vulnerable child syndrome. The answer here is E. Vulnerable child syndrome. Lupus and arthritis are often confused because they have similar symptoms. To make things even more confusing, many people who have lupus also develop arthritis and vice versa. When a person has 2 independent diseases, it's called comorbidity. And according to one article, the lupus arthritis comorbidity might be based in genetics. Just one gene in your body can cause both lupus and arthritis. Lupus cerebritis is a symptom of lupus in which brain tissue becomes inflamed, often as a result of damage to blood vessels. Since lupus causes the immune system to deteriorate, cerebritis can actually be caused by the disease itself. It can also be caused by an infection, either in the brain or blood, which results in swelling of the brain. These infections can reach the brain as a result of trauma or through the sinuses. More than half of all lupus sufferers develop cerebritis to some degree, though it can be difficult to diagnose. And what is malingering? It is fabricating or exaggerating the symptoms of mental or physical disorders for a variety of secondary gain motives, which may include financial compensation, often tied to fraud, avoiding school, work, or military service, obtaining drugs, getting lighter, or criminal sentences, or simply to attract attention or sympathy. Malingering is different from somatization disorder and factitious disorder. Failure to detect actual causes of malingering imposes a substantial economic burden on the healthcare system, and false attribution of malingering imposes a substantial burden of suffering on a significant proportion of the patient population. And vulnerable child syndrome is a condition that affects the family of an infant or child who has suffered what the parents believe is a close call with death, and then the child is thereafter perceived as vulnerable to serious injury or accident. So that's the answer here, E, vulnerable child syndrome.